While improvements in treatment and increased testing have helped to lower the number of new diagnoses of HIV in England, there is more to be done. A year ago, charities Terence Higgins Trust, National AIDS Trust and the Elton John AIDS Foundation joined forces to establish the world's first HIV commission, tasked with outlining a vision for ending new HIV transmissions and HIV-attributed deaths in England by 2030. Joining me now from the HIV Commission are Chair Dame Inga Beale and campaigner Mercy Shibemba, along with MP Steve Brine. Dame Inga, that is a hugely ambitious goal, isn't it?
Yes, and in fact, it was set out as a goal by Matt Hancock. And I was then asked if I would chair the HIV Commission, not really being an expert in HIV, but the more I learned about it through the charities that you mentioned, the more I realized it's an absolute possibility. Now, despite having the means of testing and the drugs required to end the new transmissions, we know that this won't happen by accident, which is really the task of the Commission. It was sort of to come up and say, right, what is that step change that's required? What do we need to do differently? And it's going to be a step change that requires a multiple collaborative effort right across the country. But I know if we get government committed and we get resources and people in place to take the action, I know that we can become the first country in the world to eliminate new HIV cases.
Now, looking at the figures from these new figures from Public Health England, there's obviously a decline in HIV diagnosis, especially amongst gay and bisexual men, but it is not as encouraging for heterosexuals, is it?
It isn't. And this could be partly ignorance, people not knowing enough about it. And this is why one of our key recommendations is testing, and more testing.
And maternity testing is obviously key to that as well, isn't it?
Yes, now that's a great example. I mean, it's the exemplar, actually, of what can be achieved if we have testing as normal. Testing coverage for maternity services is at 99%. The testing is done, then the medical teams can take and make the right interventions ahead of the birth. So, been a huge success. So let's learn from it.
Mercy, being diagnosed as a child is not a demographic that's currently commonly associated with HIV. Why did you decide to go public and tell your story?
Yeah, because of exactly that. People don't realise it. And I know so many times when I've said, that I was born with HIV, people are kind of like, I didn't realise that was a thing. And I just wanted to give a voice and a platform to young people living with HIV to share our experiences of growing up with HIV, because it's a completely different set of experiences. And I think it's really important.
Mercy, a lot of people won't go for testing, the kind of testing that the Commission is advocating, because they dread what that diagnosis will bring with it. But you can be reassuring about that. Look, there you are, leading a perfectly normal and, going forwards, long, happy, healthy life, can't you? So can you reassure people that testing is the beginning, not the end?
Yeah, definitely. I live a normal life just like everyone else. I've got a career that I love. I've got a marriage I love. I get to live the life that I thought I was going to live when I was a child before I knew. And actually, it's really important to get tested, because then you know your status and you can take the right action to get things sorted and work with a team to actually give you a better life.
So the government backs your goal of ending HIV transmissions. What on-the-ground action needs to be taken for you to achieve this by 2030?
We've got a 20-point action plan coming out, and it's a sort of comprehensive guide how we can get all of this collaboration working across the country. And if we do it together, we normalise HIV testing, we have it happening whenever you're visiting the doctor or A&E or visiting a pharmacy, we can get that embedded, and we know that we can achieve our goal of ending HIV by 2030.
Mercy, tell me about the Commission itself. What was it like to be part of that process?
It was an honour, but it's also the way that things should be. Young people should be involved in this. The 2030 goal, we're definitely going to be around for it. But it was really amazing to be there as a person that was actually living with HIV. So in all of the conversations that we could have, I could be like, well, actually, that's what that's how this fits into my daily reality. And particularly when we went around the country and heard from other people living with HIV, it was really nice to be able to for me to just be like, I'm gonna champion these guys because like this is my community, and I just learned how crucial it is that in our response going forward, we don't just stick to cool, like everyone in the HIV sector knows about this, but nobody outside of us does, but actually reaching across the many different parts of society and saying, actually, we need to have involvement from the media, we need to have involvement from religious groups and all of these kinds of things. And it was amazing.
Well, you both have the enthusiasm and the energy to make this target happen. Does the government? Thank you very much, ladies. Coming now to Steve Brine, MP for Winchester. What does the government need to do? What do you need to do to make sure that this target is met?
So I think it's going to be very ambitious, but it's also going to be very difficult. It's going to require a cross-government focus. We're going to require Department of Health ministers, Cabinet Office ministers to get together, report to Parliament every year so that we can account for how they're doing. It's going to really require us to drill down into these numbers between now and 2025 for the first 80%, so that we can then tackle the harder to reach at the end. So for instance, every interaction with the NHS at the moment where we take blood, for instance, we're not testing for HIV. We need to change that. Nobody should go through a sexual health clinic without being tested for HIV. And that's going to be difficult. And I don't think we should shirk from that. It's going to be controversial, and it's going to require ministers and the health service to hold their nerve. We've got a chance to really, really make a difference. And I think the public are very receptive to that right now. Let's do this. Let's hit our ambition of ending HIV transmissions by 2030. I think it's a great ambition. I think we can absolutely do it.
And on that positive note, thank you very much, Steve, and to Dame Inga and Mercy.